should give it to them and get it for them and work with them. You must remember that the governors wanted to have total control over the opening of their states, but now they want to have us, the federal government, do the testing. And again, testing is local. You can't have it both ways. Testing is a local thing, and it's very important. It's great, but it's a local thing, and we're going to get it done to a level in a very short period of time, because all of the swabs are coming in, all of the necessary materials. A lot of them, as I said, are already there, but a lot of people don't know that yet. But we'll be doing testing at a level. Already we're doing testing at a level nobody's ever done before, but we'll be doing testing at a level that the biggest tester in the world will be very happy very soon. And it's very much like ventilators. You don't hear the word mentioned, and that's much tougher when you have to build these machines. We built thousands of machines. We'll more than help the governors, and we'll make sure that everything goes well, just like it did with ventilators, just frankly like it did with face masks, on a much easier subject. As face masks, again, everything's easier than a ventilator. Ventilators are tough. But now, I spoke yesterday with the president of Mexico and with various other countries. We're going to be helping them with ventilators. We have tremendous numbers of ventilators. In fact, I understand that Governor Cuomo is going to be sending up to Massachusetts some of the excess ventilators that we were able to get, and that's great. I think it's a great thing. The number of new hospital admissions is also significantly down. When you look at these numbers, it's a good thing to see, other than the fact that we also know how people have been plague, call it. It's got many different names. In many of the hot spots, including a 50% decline over a 9-day period in New York City. That's a fantastic decline. It's a beautiful thing to see after going through the opposite. We continue to see improvement with declining trajectory of cases in Seattle, Detroit, New Orleans, Indianapolis, and Houston metro areas. More evidence that our aggressive strategy is working, and I thank the American people for their selfless devotion. The American people have done a hell of a job. We're saving countless lives, though, and again, I'll say it because I always wanted to say, well, can you leave it open? Nobody ever heard of anything like this. Not since 1917, more than 100 years ago, has anything like this happened. And in those days, they had no real communication, so you couldn't say, go inside. People just died. Almost 100 million people, it's reported. It's tough. So, the American people, what they've done is incredible. And they've learned a lot, and you see people picketing a little bit, and they want to get out. They want to get out and get back with their lives, and that's good. But they have learned a lot. They've learned about distancing, even now. At least until this thing totally goes away. They've learned about their washing their hands and all of the different things that we've been talking about ad nauseum for so long. And they get it. They get it. In some places, the governors are ready to go, and other places, they can't go yet, and they won't go. They have to have it safe. I want it to be safe, too. It has to be safe. And again, I have to say this. I can't emphasize it strongly enough. I'm probably going to show you charts of some of the countries that are really having trouble. And one in particular is having a massive problem where they said, let's go. We're just going to keep going. Well, they're the lines that we're famous for now. Some are flat and some are up. This is like a rocket ship. This country is, and they decided, let's go and let's wing it. It's, they thought it was okay, but it's a problem. It's a big problem. And there's another couple. There's one in particular that everybody thinks did it, but the people are staying in. Okay? The head of a country doesn't have to say stay in. These people are smart people. They know what's going on. They see what's going on. So they don't have to say. They could say they're not doing that, but the people are staying inside. There are not a lot of people outside sitting at cafes, despite what the mode of a country is. But if you look at Europe, most countries have done this. A couple tried not to. Italy tried not to, and they held it. And Spain tried not to. They went that way. France tried not to. I mean, nobody wants to do this. It's a brutal step. We're going to close down your country. Who ever heard of a thing like this? But we would have had millions of people die if we didn't do this. Millions of people. And I believe that, Mike. I think, in looking at things that we've been looking at over the last couple of days, I think, and really over the last couple of weeks, from the time we did it, shortly thereafter, I said we made the right decision in closing down, made the right decision on borders, banning people coming in from China, banning ultimately people coming in from Europe. But we would have had millions of deaths instead of, it looks like we'll be at about a 60,000 mark, which is 40,000 less than the lowest number thought of. So this isn't a case where people would say, oh, we would have had that number. It's similar to a flu. It's not the same thing as a flu at all, because if we wouldn't have done anything, you would have had, so a flu would have 35. It goes from 27 to 35, 40, 50 sometimes. It's over a long period of time, much different. It's even a much different death, to be honest. It's a much different death. This is violent. CMS is finalizing new guidelines for doctors and patients to resume elective surgeries. It's a big thing. A lot of hospitals were closed. They couldn't do any elective surgeries. They'll be able to start doing that. Procedures and medical care that needs to be done in person. As long as the rate of infections remains low in a community, we want patients to be able to go to their doctors, get clinically tested, and have work done, surgeries, receive treatment for chronic conditions, and resume preventative care. So we'll be allowing that to happen very soon. We had no capacity in the hospitals with what happened with the plague. We had no capacity to do it. If your doctor believes you need a treatment in person, you can get a treatment now. You can and should get a treatment now. We are asking that healthcare facilities have plans in place to keep patients safe during their visits. Some places like New York, New Jersey, where they really got hit hard,